Hello, everyone. Good afternoon. It's Brittany Cadence here, Communications Manager for Peterborough Public Health, and it's my pleasure to welcome you all to the Friday edition of our COVID-19 situation report on this last day of April. I hope everyone is doing well. And as per usual, to start us off, I will invite us to take a moment and give thanks to this beautiful land we call home. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, so I see our board chair, Mayor Andy Mitchell, is with us on the line today, and would like to invite you to share some opening remarks. Please go ahead, Mayor Mitchell.
Well, thank you very much, Brittany. Seasonal residents are an important part of our community. They contribute significantly to our economy, social activities, and cultural mosaic. In normal times, as May arrives, many community members, businesses, and organizations would be looking forward to welcoming seasonal residents, friends and family beginning their weekly trips to the area. But these are not normal times. COVID-19 remains a significant risk. It is important that everybody remember that traveling to secondary properties during the stay-at-home order carries a risk of spreading COVID-19. Visits to a secondary residence are permitted for the purposes of performing necessary maintenance. However, must be less than 24 hours in duration. Cottage owners who wish to relocate to their secondary residence must plan to self-isolate for the first 14 days in order to comply with the stay-at-home order. These requirements also apply to those who have received their first dose of COVID-19 vaccine, as all public health measures must still be followed. It is also important to remember that the use of short-term rentals, including cottages, cabins, and non-seasonal campsites, are generally not permitted during the provincial shutdown and stay-at-home order. Updated guidance for seasonal property owners is available on the Peterborough Public Health website. Life has been difficult for many, and a decision to temporarily stay away from the cottage as the weather improves is a difficult one for many. But please know that in delaying your visit, you are helping to keep yourself, your family, and both your home and seasonal communities safe. Whether it is making sure vaccines are directed where needed the most, or finding innovative ways to support our small business sector, or supporting one another as we cope with disruptions in our daily lives, as the warden would say, we are all in this together. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, let's have a look at where we stand in terms of our local statistics. So Dr. Salvatierra, if you wouldn't mind leading us through these next few slides.
I'd be happy to. Hello, everyone. So as of 4:30 p.m. yesterday, there were 82 active cases here in Peterborough. That's 6 more than we reported on Tuesday. Most of these continue to be cases that are infected with the variants of concern. The number of high-risk contacts continues to decrease and now stands at 219, down 28 from our last briefing. We're not seeing a clear drop-off yet in our daily case counts, certainly not what we'd like to see. We remain at a critical juncture, I believe, in this third wave, and we do appeal for everyone's help in bringing this local transmission under control. Sadly, we did report another local death a few days ago, which brings that number up to 14 people who have lost their lives due to COVID-19. Next slide, please. We can see that this week is shaping up now with 41 new local cases so far since Monday. Hopefully, we're hoping that we aren't going to see any spikes over the weekend and that we will be continuing this downward trend. Next slide. The number of active outbreaks in our community has increased. We now are at 6 declared outbreaks. We declared an additional one in a local workplace on Wednesday, and all of the other outbreaks remain stable. If we look at this graph, which shows our incidence rate, starting at the right of the slide, we can certainly compare our case incidence rate to both the province as a whole, and as well as, I'm not seeing the province as a whole on the in the figure. You can see really what we're showing here is Durham in yellow, Peterborough in purple, and we've got Kawartha, Haliburton, Kawartha, and Hastings. And you can see that our weekly rate continues to fluctuate, but certainly looks like it's on its way down. It stands at 61 cases per 100,000, which is a little increased from 55 per 100,000 last week. But you can see that compared to our larger Durham neighbor, they are still having much higher incidence rates, and this serves as another reminder as why we do need to stay home and not travel outside of Peterborough at the moment. Thank you. Next slide, please. Surveillance from testing at the city's wastewater treatment plant is also showing us some reason for optimism. Here you can see the testing results in the blue bars superimposed against our active cases here in the city, and it does appear to be trending down. We are seeing the signal from the wastewater is at 3 or 4 days before we're getting the human cases being reported. But you can see that this does indicate that the outbreak is potentially coming under control and that the stay-at-home order is having an impact. I've got some further good news, and that is on the vaccination front, and you can see in the orange on the left that a total of 56,409 people have been immunized here as of today. And this is about 10,400 more than last week. It does include people from our neighboring health units who are coming here for their immunization. But you can see that 52,143 Peterborough area residents have now been immunized, and that's an increase of 8,500 more than last week. We've almost doubled the number of local residents who are fully immunized. This now stands at 4,211, and that's mostly seniors and our First Nations members. In the pie chart, you can see that vaccination coverage has increased. It's increased by almost 8% from last week. We now have more than 42% of our local eligible population that has been immunized with at least one dose since we started immunizing here on January the 26th. That is great news to share. The bar graph on the left provides a breakdown of vaccination levels by age groups. It's great to see that almost 75% now of our residents who are over the age of 60 have received at least one dose. So there have been some very exciting developments over the past 24 hours with respect to the provincial vaccination plan. And we are about to see a great deal of ramping up, lots of activity, both in terms of our vaccine supply and vaccine eligibility. Yesterday, the province released this schedule for phase 2. And here you can see how the vaccine will roll out over the next several weeks. So this will take us to the end of May. Hotspots will receive 50% of the provincial supply during the weeks of May 3rd and May 10th. And since Pfizer is doubling its overall supply to Ontario, that means locally we'll start to see some of those larger shipments coming to Peterborough the week of May 17th. Meanwhile, we can see that the province is substantially expanding eligibility for the vaccine over the next few weeks. You can see how each week another age band will open up, starting with today. People aged 55 years of age and over can begin booking an appointment. And next week, you'll see that this is scheduled to go down to 50 and over. At some point in May, the week of May 10th, those who are 40 and over can book. And then the week of May 17th, 30 and over, so that by the week of May 24th, all adults 18 years of age and over can start to book their appointments. It's important to stress that when the booking system opens, these age groups will be booking appointments most likely into the month of June. And that's just, so it's important again to remember that just because an age band becomes eligible in May, it does not mean that we in Peterborough will have enough vaccine for you at that moment in May. But take heart, because as I said, as of May 17th, we are doubling our Pfizer and we will be ramping up to a capacity of at least 1,000 people per day being immunized here in Peterborough. You'll notice that the plan does include certain groups as well. That includes, if you see down the left-hand side, people with health conditions, as well as those workers who cannot work from home, both the group 1 and the group 2. And all of these groups will become eligible over the next few weeks. The provincial booking system will allow these individuals to book online and over the phone at those weeks that are noted on this schedule. And we're just working out the details of this locally, and we'll have more information over the coming days and weeks. We've only had this schedule for less than 24 hours, so it's going to take us at least a few days to put something in place for all of our eager and newly eligible Peterborough residents. If I can have the next slide, please. Thank you, Brittany. Speaking of the provincial booking system, and just to keep everyone on their toes, we're also announcing a change and a new phone number that local eligible residents can call to book their vaccination appointment if they need to do it over the phone or if they need assistance. We are transitioning over to the provincial call center effective May 3rd, which is Monday. So the number to call will be 1-833-943-3900. The provincial call center is open 7 days a week from 8 a.m. to 8 p.m. And of course, the online booking portal remains open 24/7. So this is good news for our residents. It'll be even easier to book an appointment, especially as we are able to increase the number of appointments that become available as our vaccine supply improves. I would like to take this opportunity to thank the city for their terrific support of our local call center, and to both the city and the county for loaning us their wonderful staff who helped thousands of local residents book an appointment since we opened up on March the 15th. In the meantime, we are presently only running clinics at Evinrude 4 days a week through this period of low supply. Local pharmacies also have long wait lists and are asking residents to be patient as they too wait for more vaccine to flow their way from the province. They've asked us to let local residents know that if you haven't heard from them, that's because they don't have any appointments to offer. So please don't call asking when you'll be contacted. They've got your name and they will reach out to you as soon as they can. We will all just need to wait a little longer while the hotspot regions are being vaccinated. And for us, that watershed will come on May the 17th. Today, adults 55 years of age and older have become eligible to book an appointment, and we have just issued the notification of email to the 3,000 people on the Notify Me list. As of this morning, there were about 3,300 appointments available for later in May for eligible residents. So please do book online, or as of Monday, book using the provincial phone number. So I'll end for now and give the floor back to you, Brittany. Thank you.
Thank you very much, Dr. Salvatierra. Okay, so now we have an opportunity to hear from our elected officials on the line, and I believe I see our MP, Miriam Monsef, as well as the Warden and Mayor Therrien. So let's start with MP Monsef, and please go ahead if you've got some comments for us, Miriam.
Thank you so much, Brittany. Hello, colleagues. Bonjour, Anin, salam alaikum. I'm on Mississauga territory, and I wish you all a good weekend ahead, a much quieter weekend than the last one we had, I hope. I'd like to thank Dr. Salvatierra and Chair Mitchell and everybody on the front lines of the fight against COVID and all the volunteers who are helping us get shots into arms. To date, nearly 15 million vaccine doses have been delivered to provinces and territories, and more than 13 million shots have been administered. 38% of all eligible Canadians, so those over 16, have received their first shot. Over the last 48 hours, the scheduled vaccine shipments from both Johnson & Johnson and Moderna have arrived in Canada. Combined with the Pfizer shipment that arrived earlier in the week, approximately 2 million doses were delivered to Canada this week. Next week, Pfizer shipments start to double to over 2 million a week, including approximately 800,000 a week here in Ontario. This will increase to close to 1 million a week in Ontario by May 31st. We've also now confirmed the next shipment from Moderna will arrive by May 16th and will contain an additional 1 million doses. What this means between now and the 4th of July here in Ontario, we're scheduled to receive 9 million doses of vaccines. This number will only grow as we confirm further deliveries of Moderna later in May and into June. We saw yesterday that these increased shipments will provide Ontario sufficient quantities to make it so that every adult over 18 will be eligible to book an appointment by the end of May. These shipment levels are scheduled to continue into the summer so that once everyone's had their first dose, we can start all over again and immediately get to work on administering the second dose. We're seeing these vaccines begin to have noticeable impacts among those populations with the highest vaccine rates. Federal data released by Health Canada yesterday showed that nearly 90% of people over the age of 80 have received at least their first dose, and the number of COVID-19 cases among this group has dropped significantly. Even though this is all good news, and certainly points to signs of hope that better days are near, this is not a time for complacency. While the numbers do indicate the third wave is beginning to crest, and we saw a slight decrease in hospitalization this past week nationally, ICU numbers continue to rise. More than 4 dozen military personnel are on the ground in Toronto hospitals offering assistance, and field hospitals designed for worst-case scenarios, surge capacity, are already being used. We've all heard from doctors, nurses, and frontline healthcare workers. We have heard their pleas, and we need to listen and do what they ask us to do. As Chair Mitchell so often says, we cannot mistake progress for victory. We all still need to do our part to ensure that we beat this third wave and enjoy better days ahead soon. Thanks, Brittany.
Thank you very much, Miriam, and very exciting to hear about that, the news of more vaccines coming to our community and into the country. Okay, let's invite our Mayor, Mayor Therrien, if you've got some comments to share, please go right ahead.
Hi, Brittany. Hi, everybody. Great to be here on the Friday, the last one in April. I know there's been a lot of frustration and emotions after a year of being in this pandemic, and I know that we're all feeling that. It's important to note that nobody wants to be in lockdown, but we know that in order to control this third wave and the variants of concern, we have to abide by the provincial orders and by the public health guidelines. You know, I know people are fatigued of hearing me say that and other people say that, but that's just the reality of it. The more we adhere to it and the more quickly we do that, the more quickly we will get out of this, especially with the vaccines rolling out the way that they are now. So I would encourage people to, you know, I know people are frustrated, I know people have a right to express that. I would say that I've had a lot of business owners downtown who had last weekend and prior weekends, the customers had a difficult, if not impossible, time accessing the downtown small businesses because of protesters. So while you have the right to protest, please don't block the road and please don't make it impossible for people to actually come and support the small businesses that you say that you are there to support. The city will continue to work with the health unit as we have, with the staff helping with the phone banks and all of that. We are all working together and pulling in the same direction, and we will get there. Slowly but surely. I know that the weather and the rain hasn't helped either, but there are brighter days ahead. So just stay strong. I'm in this with you. We're all in this together. Thank you very much.
Thank you so much, Mayor Therrien. Okay, so now to bring us the perspective from the county, I welcome our warden, Warden Jones. Please go ahead.
Okay, thank you very much, Brittany. And you know, I couldn't have said it any better than Diane just said it. We've got to keep this sticking together routine going on. I know the good people in Peterborough County are, for the most part, doing their very best to abide by the rules. And, you know, maybe we just need a bit of something to smile at. Everyone is so testy, it seems, these days. So we got to get out of that. We've got to know that there is light at the end of this tunnel, and we will get through it together. And I congratulate our Peterborough County staff as well. Our paramedics are out there on the front line. They've been through an unbelievable time trying their best to help out. Our public works people are out there every day as well. So there's a lot of people doing a lot of things for us, and we certainly need to give them a big pat in the back. So everybody, let's hold in there. Let's try to smile and get us through this. It's the only choice we've got. We can't delay it anymore. So on behalf of Peterborough County, thank you to everyone on here who's doing whatever they're doing to help out. You help one, you're helping us all. So thanks, everybody. Keep doing it.
Thank you, Warden Jones. Okay. Let's now invite our media guests to answer or to ask their questions. And I see also that Chief Gilbert from the Peterborough Police Service has kindly joined us today as well. So if there are questions for him, if our media could just indicate who the question is for when they're asking it. So I'm going to invite Trent Radio. I see Rob is here with us today. Do you have some questions for our speakers?
Hi, thanks, Brittany. I just have one question for Dr. Salvatierra. I know you've mentioned several times over the last year and change that one public health measure that would be very important is paid sick leave for employees. And we've seen this week, I guess it's working its way through the legislative process now, that there is some measure of paid sick leave coming from a provincial program. Do you have any comment on the program that's been proposed or that's been announced by the provincial government, and whether it might be the sort of adequate or might be an adequate measure based on what you have advocated for in the past?
Well, I think what we need is something that is seamless so that people don't see their pay interrupted. And so definitely having the employer compensated for providing people with their regular pay despite illness makes the most sense. It also needs to bridge them over to the point where the federal benefits come into play. I think there needs to be assistance for people to get those federal benefits, because I don't think it's as easy as everyone might think for certain parts of our population that they need assistance with that. And I do wonder whether 3 days will be sufficient. I mean, just think, if you're sick and you have to be tested, typically the wait is 2 days. Potentially 3. So 3 days might be enough for someone to isolate at home while they're waiting for a result. But then there are those who will need to isolate at home because they are potentially a household member of someone who's a case, or because they've been notified by us that they are a high-risk contact. And so we need to make sure that whatever is put into place is able, it goes into effect right away. And as I said, bridges people over to when they can get the federal benefits. So I'm not sure if 3 days is going to be enough. But what's important is that it be accessible and it be immediate, so that finances are not barriers for people to stay home where they belong when they are ill or when they need to isolate.
Okay, wonderful. Thank you very much. I think that's everything for me.
Okay, great. Thanks so much, Rob. Okay, let's hear from Paul Rellinger from Kawartha Now. Do you have some questions for Dr. Salvatierra?
I do, Brittany. Thank you, and for Chief Gilbert, if I may.
Sure.
You mentioned the vaccination supply and what's going to be happening the week of May 17th, which is very exciting. So can we take that to mean, based on the number of vaccinations over the past week, that our current supply is pretty much exhausted at this point?
We continue to get supply, Paul. So, for example, we are expecting the Moderna to arrive today or tomorrow. So we get replenished. With Moderna, it's only twice a month. With the Pfizer, it's weekly. AstraZeneca is the one that's sort of missing in action right now. We don't have any sight lines for AstraZeneca, and we do know we're going to be getting some Janssen. We just don't know how much, and we don't know for whom we can use it. So we do get replenished. We are able to, that's how we actually set up our clinic appointments. It's based on those projections. And so we do have clinics operating. We've got some appointments available before the end of the month, but we are not able to run clinics, for example, every day. We just don't have enough vaccine. Everything changes May 17th. That's when our Pfizer supply doubles. And as of May 17th, we will have the capacity to deliver about at least 1,000 immunizations per day here in Peterborough. So we are, we'll see things ramp up and hopefully even more so as supply increases again in the month of June.
Thank you. And you also mentioned that you're asking people not to call pharmacies if they've made an appointment. That list of pharmacies, at least here in the city, has been at 4 for quite a while. Do you anticipate, as we get more supply, that number of pharmacies will increase at some point?
I do believe that is the intention of the province. They know how many pharmacies were involved in our influenza immunization, and they will go back to those pharmacies. And as you know, here in Peterborough, we had lots of pharmacies that were providing influenza immunization. So the list is, I do foresee that there will be more pharmacies, not only in the city, but even more important, in our rural communities. I'm thinking particularly of Havelock, where there isn't a family physician in town, but there are 2 pharmacies in Havelock. So we do want, we expect that to grow. I think the issue right now is that the AstraZeneca supply it has been exhausted. It's been completely depleted, both in pharmacies and in primary care. The province has begun a pilot with 8 pharmacies in the Peel and in the Toronto area to using Pfizer to see how that might work. I mean, Pfizer, once it thaws, has a storage life of 5 days. And we don't want to waste any of this precious vaccine. So the pilot will demonstrate the feasibility of having Pfizer delivered through pharmacies. And based on that pilot, which will take 2 or 3 weeks, we may see Pfizer coming down the track for pharmacies as well. So I don't expect the pharmacies will expand right now because there's no vaccine for them. But certainly I hope that by the end of May, we will see more pharmacies in Peterborough able to provide vaccine.
Thank you. And Dr. Salvatierra, as you're aware, a number of people have received their first dose of AstraZeneca. Based on what you just said about supply of AstraZeneca, can you kind of put their mind at ease that a second shot will be coming? Because you know, I guess there are people out there who may think, well, I got my first shot. Am I ever going to get my second shot? And are you confident that when the time comes for their second shot, they'll be looked after?
Hey, 16 weeks in a vaccine rollout is a lifetime, Paul. And we were assured by the province that there will be second doses for people when they are due. So everyone should relax and try not to worry about second doses. We have your backs. We will be planning with the province, and we will have the capacity to deliver. And that's we, the royal we, that includes public health, it includes the hospital, primary care, and pharmacies.
Great. And I had one more vaccine related question. You mentioned the numbers over the past week of people who've gotten vaccinated. You said that number does include some people from neighboring health units. What's the view or the situation regarding people coming from out of region to our region? Is that something you encourage when there are people here who are waiting to get their shot?
Well, depending on where you live, the Peterborough clinic might be the closest for you, even though technically, you know, you live in another county. So, or you might work in Peterborough, but maybe you live somewhere else, and it makes a lot more sense for you to get your vaccine here. So we understand that we need to be flexible and that we need to make sure that the vaccines are convenient as possible. I completely expect that come the summer, when those second doses are due, we are going to have seasonal residents here with us who won't be going back to wherever home is. They're going to want to get their second dose right here, close to where they live in the summer. So we will plan for that scenario, and we are counting on the province to make sure we have enough vaccine for everyone.
Thank you, Dr. Salvatierra. That great answers. I appreciate it. And I had a question, if I could, for Chief Gilbert, if he's on the call. Chief, thank you. I've been reading on social media, as I'm sure other people have, that there's an anti-protest plan for this Saturday. This is something we actually talked about, I think, a couple of media briefings ago about the possibility of that happening. First of all, the police position on that protest, and And I guess the same rules would apply as they would apply to the protests we have seen, I guess.
That's correct, Paul. We're still in lockdown. People are supposed to be staying at home. I appreciate that people are upset about what's going on with the current protest that keeps showing up at Confederation Park, but don't compound the problem by engaging in the protest. The best thing that you can do is not give them any airtime, not give them any attention, and just go about your own business and stay safe. We've seen that, although they say it's an anti-lockdown protest, you don't see them wearing masks. So it's just we're not going to follow the rule protest. So for those that are interested in a counter protest, my strong recommendation is stay at home and do your best to stay safe. We did have some people last week, one gentleman in particular in the park that was shouting his views that were contrary to those that were in the park, and we had some members of the large demonstration come up to us and tell us that we should get him out of there before he gets hurt. So, free speech, I guess, only goes one way, and you're not allowed to listen to other people's free speech was the message that they were saying by saying get him out of there, he's going to get hurt. So again, stay home. I've seen the info on social media. There's not a large following to it. And please stay home, stay safe. And that's the same recommendation for the others that keep wanting to show up to Confederation Square. Stay home, stay safe, and we'll get through this a lot quicker.
Are you aware, Chief, of anything organized for this Saturday from the anti-mask people, VAC people?
Well, there is a protest that's planned for this weekend, and that's the reason for the counter protest. It's targeting them, but there is a protest planned for this weekend as well.
Okay, thank you for that. And I guess we can be grateful there isn't a protest of the protest of the protest yet. So thank you.
Okay, thank you, Paul. Sounds like you're wrapped up, so I will now invite our next reporter. How about Bill Hodgins, who's joining us from my Kawartha in Peterborough this week. Good to have you on today. Bill, do you have some questions today?
Yeah, for Dr. Salvatierra, please.
Okay.
And it's kind of a follow-up to Paul's question about second doses. Mm-hmm. A lot of people who got their first dose weren't given a date for the second one. And I've had people ask me, with an influx of more coming, should they contact the health unit to book their second dose, maybe in hopes of getting it earlier or something like that? Is that something they shouldn't do?
Well, we're not yet, because we aren't posting those clinics yet. So right now, 16 weeks for many people. I know when I was in the clinic immunizing, we were giving second appointments in July. There will be appointments. The COVAX, the database that we use to immunize you, does have everybody in it. So it knows when you got your first dose, whether or not you were given a second dose. I know, for example, I got mine at the end of the day at a clinic, so I also don't have a second dose. I would suggest that people who are in that situation write it down, calculate when they're due for their 16-week dose, put it in their calendar, and then maybe a couple of weeks before then, they can go in and book it if they haven't already been notified that they're due. Because if we do get more vaccines sooner, those doses will move up. The online booking system has now been updated so that it can book a single visit. That wasn't possible earlier on, but now it is possible to go in and just book one appointment, and it will know when you are due. So it should help you. But the issue is that those clinics in July are not posted yet. So it's too soon to try.
Great. That's the only question I had. Thank you.
Okay, thank you, Bill. So let's now invite Joelle Kovac from the Examiner. Do you have some questions for our speakers today?
Yeah, I do, for Dr. Salvatierra. Do you have any details that you can share at all about that 14th death, like age or man or woman, or if it was attached to any of the outbreaks?
So what I can share is that sadly this was associated with one of the outbreaks. It was a household member of someone who did contract COVID at their workplace. I'm not aware of age or sex, so I can't share that with you. But I do know the details. So very, very, very sad and unfortunate that this individual contracted COVID because someone brought it home, and that this person contracted it at their workplace.
I'm very sorry to hear that. Thank you for offering that. Okay, that's about all I had to ask. Thanks so much.
Okay, thank you, Joelle. Let's turn to your colleague, Reg Watson. Did you have any questions today?
I am good. Mr. Rellinger and Mr. Hodgins touched on the question that I already had on the second doses for AstraZeneca. Thanks.
Okay, great. So then we'll move on to Matt Latour from our local radio stations. Please go ahead, Matt.
I've got a couple questions, all for Dr. Salvaterra. I know Premier Doug Ford was on earlier today, and he said that 90% of the cases in Ontario over the last week have all been variants of concern. Does this change the approach as far as public health measures here locally go and vaccinations moving forward?
Well, I think what the variants of concern mean for us is that we have to use our public health measures to protect ourselves and others. And so more than ever, we need the social physical distancing. And right now, we must stay home. So unless people have an essential reason to leave their home, we are essentially sheltering in our homes for the duration of this stay-at-home order. And we're doing that because we're trying to shut down the transmission of these variants. So we can't immunize our way out of this. Immunization helps, but the only way we can really stop the transmission of the variants is to stay home, not to travel, and not to socialize with anyone outside of our household.
Piggybacking onto that, I know Mayor Andy Mitchell mentioned this as well. And if you did, I apologize. I missed the first couple minutes. But did you have a message to anybody either locally that's looking to travel to a cottage or vice versa?
We are asking, well, in fact, the provincial order makes it very clear that no one should be going to their cottage or their secondary residence unless they're going there to perform some kind of essential or emergency work. And if they have to do that, that they can't stay more than 24 hours. So it's essentially, it's an in and out for the purposes of whatever that work is. So I certainly second that should be the only reason anyone's going to their cottage. If people are choosing to transition over to their seasonal homes, they can do that. That is permitted at this time during the stay-at-home order, but they must self-isolate for the 14 days that they are there, the first 14 days. So they need to go and they have to be prepared to be self-sufficient and bring everything they need, and they cannot socialize. My worry with the cottage is that it is a place that we associate with socialization. And we might let down our guard. We might, we may have family over, or we might choose to socialize with the neighbors if they're also there. None of this is recommended right now. We really cannot be socializing. We have to stick with our household members, and the safest place to do that is at home and not at the cottage.
We've seen a lot of long lineups in places like Toronto and Scarborough for people lining up to get vaccines. How happy are you with the response you've seen from people here locally trying to get a vaccine?
First of all, I'm happy to see people in the hot spots getting their vaccines, because if we need them to be immunized if we're going to try and prevent the hospitalizations, ICU admissions, and deaths that we're seeing in this third wave. Secondly, I am very proud of Peterborough and the residents here for their patience, because they are having to wait a few weeks longer. They can maybe get an appointment, but it won't be for today. It won't be for tomorrow. It's going to be for 2 or 3 weeks down the road. And that's because we are supporting this redirection of vaccine to the hotspots for these next couple of weeks. As of May 17th here in Peterborough, we can open up the floodgates. We can ramp up to full capacity and immunize 1,000 people a day. So far in Peterborough, it's just great to see how eager people are. We have immunized about 42% of our local residents. That's above what the provincial goal and target was, which for today, which was 40%. So we're above that, even with the relatively reduced vaccine supply that we've had to work with here in Peterborough. So thank you, everyone in Peterborough. Thanks for rolling up your sleeve, for showing up, for getting immunized. And now we just need you to stay home.
Perfect. Okay, I'm almost done. 2 more questions. I came with more than usual today. As you mentioned, you know, the vaccine timeline looks like it's going to be expedited quite a bit over the next month. Do you think this is kind of a realistic timeline, or do you think it's a little bit too optimistic?
No, I think it's based on the great news that we've heard from our MP, Monsef, about the federal procurement of vaccines. I think we should be very pleased with how well Canada is doing with accessing vaccines, and we are going to benefit from that. We have benefited from it, and we're going to see more and more local people being able to be immunized, to get that protection, thanks to the increase in supply that we are expecting.
Perfect. And my last question, it's something that we've talked about in previous briefings. You had mentioned that the local death was a household member connected to a workplace outbreak, and we're seeing, it feels like more and more of these workplace outbreaks. Can you just reiterate why, you know, the health unit doesn't give out information about where these places are and stuff like that?
Well, with all outbreaks, Matt, if they are small enough that we can contain them, where we feel very confident that we've been not only able to identify cases in the workplace, but that we've been able to notify all of the high-risk contacts. If our work is complete and everyone is self-isolating, and often these workplaces close voluntarily for the duration of the outbreak, there really is no public health risk. There is really nothing for us to share with members of the public. If, on the other hand, the workplace is one where we believe members of the public may have been exposed, we will do everything in our power to ensure that people are notified, are aware, and know what the actions are, whether it means people need to monitor or whether people need to be isolating or to be tested. We will get that word out to the public, and to do that, it may mean sharing the information about the workplace, and we are prepared to do that when there is a really good public health reason for it.
That's it for me. Thank you. Have a great weekend.
Sorry, thank you, Matt. Okay, let's move on to our global colleague. I think I see Jessica here. I think Greg has left, but Jessica, if you've got some questions, please go ahead.
Sure, thanks, Brittany. I just have 2 quick questions for Dr. Salvatierra.
Hello.
Hello. Dr. Salvatierra, did you mention the date of the death this week?
No, I didn't, Jessica, and I'm trying to think. It was after the last media brief, so it could have been any time from Tuesday evening to Wednesday evening. I'm not quite sure, but we can certainly find that out for you if you like.
Thank you. And just lastly, I'm going to be mentioning the new call number for booking. I guess that I just feel like that might make people think that they should be calling instead of going online. What is the preferred method?
Well, it depends, really. I mean, if people are self-sufficient and have access to the internet, and they are eligible because of their age, they can go online and book it themselves. There are some groups that have to access the bookings through the call center. So right now, for example, if you're pregnant or if you are a child care provider, a licensed child care provider or a special education teacher, you need to go through the call center to get those appointments. So we will be providing a little more detail next week for everyone. So everyone's clear as to whether they can go straight online if they can, or whether they need to go through the call center. But the call center is there also for those people who don't have internet or who can't access the internet or want that kind of assistance over the phone.
Perfect. Thank you very much, Dr. Salvatierra. That's it for me.
Okay, wonderful. All right, well, I think we have heard from everyone then. So again, thank you so much, everyone, for joining us today. Do have a safe weekend. Stay warm, and we will see you back here next Tuesday for our next COVID situational update. Have a great weekend. Take care.
Thanks, Brittany.
Thanks, everybody.
Thank you.